So disasters, such as pandemics and other types of disasters, have the dramatic impacts on mental health and substance use. And this has been demonstrated over and over again in the scientific and medical literature, and certainly it's been our experience here in the greater New Orleans area, given the number of disasters that we have experienced to date. We know that hurricanes, terrorist attacks, oil spills can worsen mental health symptoms, and they can lead to an increase in the burden of symptoms of depression, anxiety, PTSD, substance use disorders. There are studies that have demonstrated, for example, after Katrina that we participated in, that as many as 40% of the affected population had substantial symptoms of depression, anxiety, and or PTSD. And when a community is trying to face a new challenge and to recover from that challenge, it's really substantially inhibited and limited by population-wide impacts that can be so disabling as that. These disasters, including pandemics, do contribute to long-term consequences and disability, particularly, people who have prior experience of mental illness or substance abuse, of course, but also to people who are exposed to high levels of stress or trauma, who maybe did not have previous problems in this area. And additionally, we know that there's a higher risk and potentially worse outcomes for people who may not be able to access high quality care or supports. And in the current environment of social isolation and social mitigation strategies with people staying at home, we can appreciate that this is something that many people may struggle with. Prior disasters and pandemics also reveal that healthcare workers who are dealing with the front line of this crisis also face elevated risk of worse mental health outcomes. And that's something that is really relevant for my colleagues here at the Health Sciences Center and our friends who are working in the hospitals and clinics trying to deal with this on the front line. Next slide, please. So we can expect that the COVID-19 pandemic, based on this knowledge from prior experiences and the many studies that have been done in the past, will affect mental health, and will affect mental health in multiple ways. We can look to higher risk of worse mental health outcomes among those people who have severe infections, for example, and maybe we're in the intensive care unit, and there is a substantial body of work that shows that people who have been traumatized in some way and ended up with very severe exposures to a given trauma, such as this type of an infection, can have adverse outcomes from that, or for that matter, for people whose loved ones unfortunately were killed in the context of this pandemic. We know, as mentioned, that healthcare workers and also first responders who are on the front line of this and dealing with this every day may be at risk. People with prior mental illness, as I mentioned, will see exacerbations of their mental illness potentially, as well as those with risk factors for infection. In this particular instance, we know that a lot of people who have chronic physical conditions, high blood pressure, heart disease, or immunodeficiencies, for example, may be at elevated risk of ending up in the hospital or ending up with a worse outcome. And that's going to be scary for many people and definitely pose a tremendous amount of stress and strain on them at this time. And for that matter, then people who otherwise feel that they need to access some sort of resources or support, including clinical care or other supports, but are unable to do so, whether that's because of the social distancing efforts that are put into place or because their usual efforts or their usual resources that they might go to, whether it might be church or healthcare system or social supports in other settings, are limited right now because we all have to stay at home. We know that the experiences of potential or actual infection during the pandemic will impact mental health. This prolonged physical distancing or social distancing has the opportunity to impact mental health, as well as the isolation that people can experience as a result of that. And then lastly, but definitely not leastly, there are going to be tremendous economic consequences of this disaster, some of which we're already observing, which, a variety of different people and government agencies and non-governmental organizations are working to try to mitigate. But those are going to be very real given the unemployment and the challenges that people are going to face as a result of not having enough financial resources. Next slide, please. So if we want to tackle this at scale, this is now, a worldwide pandemic It's affecting our country certainly, and our entire state, and particularly, as a recent hotspot, the New Orleans area is in great focus for us here at the LSU Health Science Center. In addition to the state of Louisiana, we have to think about mental health approaches at scale that can really tackle this, and those really require a public health and resilience focus. A public health focus because we really need to think about how can we tackle this not from the perspective of, okay, I see one patient at a time, but how can we bring resources to bear to support people who are dealing with this struggle across our communities that are affected. And a resilience focus because as we try to treat people and try to help people get better, we also have to be thinking about how can we help ensure that people are going to be in a better position after this. So we need to bolster resilience so that people have the ability to adapt and to bounce back from this and be strong for future challenges that we're going to face. We may have future pandemics, we may have future hurricanes or things like that. So the National Academies of Sciences defines resilience as the ability to prepare and plan for, absorb, recover from, and more successfully adapt to adverse events. And so that's really an area that a lot of our work here at LSU has focused on, in addition to trying to mitigate the mental health impacts for vulnerable populations. So as we move forward and collectively to minimize adverse impacts and try to enhance the health of at-risk populations, our solutions have to include thinking about the availability of effective resources. So we have to have well-researched, proven effective resources that we can apply to whether it's someone in the clinic or someone who maybe is at home and accessing some type of supportive resource by telehealth. It can't be a hunch that these things work. We need demonstrable research that can show and clinical evidence and practical evidence that these interventions actually help people. Secondly, we need to think about the utilization of appropriate resources relative to needs. So while if many people are experiencing anxiety and depression and PTSD or increased risk of substance use at this point, there are only a handful of psychiatrists in any given community. And not every single person, if it's thousands upon thousands upon thousands of people who are experiencing these challenges, will have access to a psychiatrist just based on the numbers. So we have to think about what level of resources can provide the high quality care that might be necessary. Are there certain things that a primary care provider can offer, certain things that a social worker can offer, a psychologist, a psychiatrist, a community health worker, a nurse, and can we build the teams that allow us to allocate resources appropriately relative to the high level of need that we're going to be seeing at a population level. This is what we do in the context of other types of disasters, and this is what we need to do now. We also have to ensure that there's equitable access to these resources. So these resources that we're hoping to be able to make available to people increasingly as they experience symptoms of worsening mental health in the context of the disaster have to be accessible regardless of, does someone have a different type of insurance? Is someone able to see someone face-to-face, across a 6-foot distance, social distancing for a visit with a healthcare provider, or are they someone who's at home and is going to have a difficulty with that? And can we make, digital and telehealth and virtual resources increasingly available to support people so that high quality opportunities for care and high quality opportunities for mitigation of these adverse consequences are available in a very equitable way across our community. And we really, as we move forward, we also want to keep in mind, what are we also doing to support resilience, to maximize the likelihood of healthy adaptations so that people won't be at risk of future negative consequences if they face future stressors, but they might bolster their resilience so that they can be better prepared and better able to respond and recover and live a healthy life. Next slide, please. So our current and prior efforts, which I won't go into tremendous detail on, but to highlight some of them, to improve mental health and substance use outcomes in the context of disasters and otherwise. I've included a long track record among my colleagues here at LSU and at the Section for Community and Population Medicine and in our Center for Healthcare Value and Equity, as well as with our many community and academic partners with whom we work here in the New Orleans area and across Louisiana and across the country. We have examples dating as far back as Katrina, where we developed community academic partnerships such as Reach NOLA, which developed ways to better serve particularly under-resourced people who were going to community organizations to get help at a time when many of the hospitals and clinics were closed or healthcare providers were displaced. We develop health and resilience centers in communities to provide a locus, and we can probably consider how do we developing virtual health and resilience centers to ensure that people can access the types of resources that they need to support themselves in the context of all of this physical distancing and the social distancing and the potential for not being able to come together face to face. We developed a program with the support of the American Red Cross and the Robert Wood Johnson Foundation called the Mental Health Infrastructure and Training Program, which trained more than 400 providers from more than 100 different organizations in the greater New Orleans area on how to provide high quality evidence-based care for depression, anxiety, and post-traumatic stress disorder, as well as how to work in teams in a collaborative care model to use the best available evidence to try to improve outcomes at a population level among people who were potentially at risk but had fewer opportunities for access to care. We have current projects such as the Resilience Against Depression Disparities project, or RAD, which focuses on developing peer-led and professionally mentored groups to provide supports for people to help them reduce the symptoms of their stressors, to reduce the likelihood that they're going to experience, for example, symptoms of depression, particularly among community members and populations that are at high risk for disparities in this, who have lower access to care historically and who potentially have worse outcomes historically based on the scientific evidence to date. And then lastly, but not leastly, we also have a National Academies of Sciences funded program of activity called the Community Resilience Learning Collaborative and Research Network, or CLearn, which is found at www.clearn.org, c-learn.org. And this is a study and program of activity here through LSU, which is supporting the development of novel resources for improving mental health and enhancing resilience with the supports of different community organizations here in the greater New Orleans area and in South Louisiana, and which we're just working with partners across the country to disseminate what we're finding and bring the supports to other places. In addition, our efforts since the start of the pandemic include expanding and modifying clinical services to permit telehealth and distance care opportunities. We're doing that in our clinics, where I see patients through the LSU Health Network as a primary care doctor, which has included already providing care for people with depression and anxiety and PTSD symptoms, as well as in our opiate use disorder clinic at University Medical Center, where we're providing care for people who are at very high risk of overdose right now because of the stressors that they're experiencing. So we are expanding that. We're also developing new resources and distributing them to enhance the knowledge enhance the knowledge base of what can be done and to foster mental health and resilience among our LSU Health and CLearn partners. We're expanding our current programs and protocols to enhance the use of tools for people affected by COVID and its aftermath, including virtual training programs for improving quality of mental health care, to specifically target the types of challenges that are emerging following the pandemic or during the pandemic. We're taking our current digital platforms and modifying them to roll them out even further to promote mental health and resilience. And these are accessible by phone and computer. And we're also transitioning to virtual peer support groups to support resilience for people, particularly people who are at risk of disparities. Next slide, please. So our next steps for mental health in the COVID-19 pandemic moving forward is that we continue to sort of actively develop opportunities for funding to assist with the mobilization and distribution of our existing resources to help people affected by the crisis during the COVID-19 pandemic. We're expanding our partnerships with national, state, and local partners to better serve the impacted communities. We're developing new tools for digital and virtual supports to enhance mental health and resilience. So these tools can be made available in a way that's equitable, accessible, and high quality. And now if we can go to the last slide. So I just want to express appreciation to everyone who was able to join us today, and to the LSU Health Foundation for bringing us together. And my contact information is on the final slide. Please do not hesitate to reach out, and I appreciate all of you. Please stay safe. I look forward to question and answer now. Thank you.
Okay. All right, Crystal. Sorry, I'm getting all of this back together. Okay. So we want to go ahead and start questions. I will see what we have lined up here. One question that I had was about, so you were talking about the resources, putting together teams to help as we move forward to help people. Have you started, has anyone started putting together those teams? Have you all started getting all of these things in place that you were talking about?
Yes, we can look to, for example, we have the training materials that we've previously developed and have been rolling out with our partners in the context of the pre-COVID period, in which we've provided training and supports to enable clinical organizations and non-clinical organizations to think about, all right, how do we appropriately screen and triage people who may be presenting with mental health challenges during this difficult time. So, and if there are workforce limitations, who can do these types of things most effectively, so that the highest level or most difficult tasks can be done by the people with the highest level of training and experience, and the simpler tasks can be done by people who don't necessarily require, having a doctorate, for example. So we've rolled out these types of trainings over the last year already in an online format, and now we're modifying the trainings to support clinical organizations outside of LSU, as well as our own organizational capacity to be able to use these models to provide high quality care.
Okay. This is a good question. Actually, I've heard this from several people. I've heard that it's common to confuse anxiety symptoms with COVID-19 symptoms, such as breathing and tightness in the chest. Have you seen this? And is there a way that you recommend telling people to decipher the difference?
Yeah, it's a really difficult question, because so many of the chest tightness or shortness of breath can really be a symptom of anxiety, or if someone's having a panic attack, for example. It could also be a symptom of other, non-COVID related health problems, like a heart attack, which is a common thing that people feel when they're having a panic attack. Oh my gosh, I'm having a heart attack. Well, maybe you're not. Maybe it's a panic attack. But then also newly, we know that people have these symptoms in the context of COVID. It's very difficult to discern them when you're sitting there at home. I think that the trick is, if there's a telltale sign like a fever, well, then you can probably lean in the direction of, oh yeah, but if there's a fever in addition to those signs, that could be an indication that it's COVID related. But at any rate, I would probably encourage, please do reach out to your healthcare provider. Don't sit at home with chest pain and shortness of breath. If you start getting short of breath, and you feel like you have immediate access to your doctor, contact your doctor's office to get guidance. If you don't have immediate access, it's really a good idea to reach out to the local emergency department. You don't want to be in a position where you're having a potentially adverse event at home.
Right. Okay. Claire is asking, is there any specific work being done on resilience?
Yes. So we have, as noted, we have an active project presently called the Community Resilience Learning Collaborative and Research Network. It's a large program of work funded by the National Academies of Sciences, which I lead together with my partners in community settings across New Orleans and here at the Health Sciences Center, as well as partners from UCLA. And we are developing and testing strategies to enhance resilience across community collaborations. So organizations within the community, clinical and non-clinical, to work together to support their patients and clients and stakeholders, as well as developing and testing digital platforms to enhance mental health related resilience as well. And so we're now in the phase of, over the last 6 weeks, working with our partners to modify those resources and modify those tools and modify the experiments and tests that we're developing, and to be able to accommodate the new reality. There's a new reality, which is COVID-19 is going to be dramatically impacting our communities for a long period of time to come. And so we're trying to make sure that everything that we're putting forward now is really focused on the new reality and how can we best support our community organization partners as well as our patients and community members now.
Right. You mentioned the problem with overdoses with people because they're under stress. Have you also been seeing more than usual?
There hasn't been data specifically released to my knowledge yet from the Louisiana Department of Health on overdose related deaths. I honestly think that when we pull the curtain back, and when there's a little bit more room for people to think about challenges other than specifically COVID, like you can imagine all of the resources for the hospitals for weeks have been focused on COVID. All of the resources for the Department of Health for weeks have been focused on COVID. And so there hasn't been a lot of opportunity for them to go back and, discern and take out and count, okay, what have we seen in terms of overdose deaths? We know, however, from the prior experience with other disasters that the risk of substance use is only amplified, and that people who have substance use challenges also face, significant stressors which affect their mental health during this time, and that only leads to an increased risk of, use of drugs and overdose. So it's an unfortunate consequence. We are expanding our opiate use disorder clinic at the Integrated Health Clinic at University Medical Center. We are expanding our services to include telehealth visits for our patients. We are accepting new patients. We are doing everything we can to try to make sure that the emergency room doctors and other doctors who encounter patients who are going through these challenges know, hey, refer your people to us because we can make sure that they continue to get the care that they need.
Right. Here's a question. Do you anticipate an increase in prescriptions for depression and anxiety due to this pandemic?
I think it's reasonably likely to expect that we're going to see, a lot of, because of the breadth of not only the people who are impacted by the mental health, by the disease itself, by COVID itself, or whose loved ones were affected by COVID, who may experience anxiety and depression as a result of that, but because of the economic consequences and because of the social isolation, which many people are experiencing now, we are going to see increased population levels of anxiety and depression and PTSD. And we will probably see increased, efforts to try to mitigate that or to treat that, which will include medications, will include therapy, will include novel approaches such as the digital and virtual approaches, which I highlighted.
Mm-hmm. Yeah, and it sounded like from your talk, one possible problem, I guess, will be just making those resources equitable and attainable for everyone.
Right. I mean, fortunately, in this context at this point, many of the digital platforms are widely available. If people, still have access to a phone or a computer, which not everyone does, but if they have a phone or a computer, that provides an opportunity to reach them in their homes, which can be a terrifically important step for people who have limitations or who otherwise might not be able to access their healthcare provider. And some of these things are clinical supports, so that there can be telehealth clinical supports to get to people in their homes, but there are also supports to help people manage their own symptoms and check their own stress levels and try to reduce their stressors before it gets to the point that they develop diagnosable illness.
Okay. And one more question. Do you have any recommendations on steps an individual can take right now to increase resiliency?
Yeah, I think one important step is to really try to maintain as much social connectedness as you possibly can right now. Many people, as a result of the isolation they're experiencing because of the physical distancing, the social distancing that we're all engaged in, don't have access to their usual support structures, and so staying in touch with the people who are important to you in your life, making sure that if you're used to going to church, that you access the online services available through your church if that's something that's being offered, making sure that you're taking the steps. If you really start to feel like you're going into a spiral, make that appointment to support, to reach out to your healthcare provider, to make sure you're getting the necessary care that you need. Take the opportunity to go outside and go for a walk. you know, as much as we are being, you know, sitting there in many instances, having tunnel vision in front of our screens or in front of the television set, looking at an onslaught of bad news, getting outside in the beautiful weather presently, recognizing, hey, there are still birds chirping. I can still get some exercise. I might be able to wave to my neighbor or say hello. Can really help relieve some of the immediate, you know, cloud across our perceptions.
Right. Yeah, that's good advice. Thank you. Okay, so we are going to wrap up questions right now. I just want to let everyone know that we will be hosting these webinars for the next couple of weeks, and you can find the link to today's webinar on our website, on LSU Health Foundation's website. And that is at, hold on one second, lsuhealthfoundation.org/coronavirus. The next webinar that we'll be doing will be an overview of prevention and treatment with a few new concepts with Dr. Fidel and Dr. Hagensee, and that will be tomorrow at 10 a.m. And you can find that information on our website as well.
Thank you, Sam, and thank you, Dr. Springgate. I think that was a very timely webinar with much needed encouragement and information. I know for myself, speaking just for me, it's definitely been difficult to juggle everything that's kind of come at us with this coronavirus, and school and working from home and the social distancing and all of it has definitely been something to experience, and the resiliency is definitely something to prioritize and work on. So thank you for that information. And please join us tomorrow, and everyone take care and stay well. Until next time.
Thank you, everybody.
Thank you. Stay safe, all.